Hey, I think we can get started. It's now 12:01, which was the official start time. So hi, I'm Roger Wakimoto. I'm the Vice Chancellor for Research and Creative Activities at UCLA. And I want to welcome you to this conversation on homelessness in California, featuring expertise from two UCLA researchers. So a couple comments I want to make. More individuals experience homelessness in California than any other state in the nation. The per capita rate of homelessness in California is more than 3 times that of the rest of the country. More than half of all the unsheltered homeless people in America live in California, and that's actually up from 40% just 5 years ago. Decades of study and experience have revealed multiple causes and public costs of homelessness. The costs for addressing homelessness continue to escalate, spurring greater urgency to improve conditions. Of course, we need to balance the pressing need of resources to alleviate homelessness alongside California's economic and workforce recovery. Now, we're really pleased that so many key legislative staff could join us today for this briefing on a very significant issue for our entire state. We hope this conversation advances awareness of the pertinent research that can inform public policies and best practices. Just to make sure you understand that this webinar is being recorded, and we'll share the link with everyone in a few days. In just a few minutes, I'll introduce the first speaker. There are two, as I said at the beginning. Each will make about a 15-minute presentation, and will be moderating the Q&A at the end of the presentation. And we encourage you to submit your questions using the Q&A feature, which I'm sure in the Zoom world you're all very familiar with. So really, those are the introductory comments. I'd like to now start by introducing our very first speaker. Our first speaker is Gary Blasey. He joined the UCLA faculty in 1991 with a distinguished 20-year record of public interest practice. He's one of the founding and core faculty of the law school's unique David J. Epstein Program in Public Interest, Law and Policy. He practices, teaches, and conducts research and writes about advocacy on behalf of children in substandard schools, homeless families and individuals, low-income tenants, low-wage workers, veterans, and victims of discrimination. He's received numerous awards for distinction in the field of public interest law and for providing legal services to the poor. In 2007, he was named one of the top 100 lawyers in California, cited as the go-to lawyer for community groups in need of advice. In 2013, he received the California State Bar's Lauren Miller Legal Services Award, given to one lawyer in California each year for his or her work in extending legal services to the poor. His research tries to better understand how people understand the causes of problems like homelessness or poverty, how advocates can best deal with the consequences of racial and other stereotypes, and how large bureaucracies can better respond to the needs of poor people and people living with disabilities. He also serves as the director of the UCLA Institute for Research on Labor and the Environment, which supports research and education on issues critical to working people. So without any further delay, Professor Blasey, please.
Well, thank you, Roger. Appreciate that introduction. I am going to speak for about 15 minutes. I just started my timer. And if we can go to the second slide. So as Roger mentioned, half of all the unsheltered people in America are in California. To put that in some additional context, a big part of that population, as with the general population, resides in Los Angeles County. But homelessness is a California statewide issue, as I'm sure all of you know. The last time we counted, which was in January of 2020, there were about 161,000 people who were unhoused in California. That's equal to the complete population of Santa Rosa or Ontario. It's a large number. And we are at some risk of that number increasing dramatically. We weren't able to count again in January, as we have done annually for many years. But beginning in July, evictions will be permitted, and we don't know yet how much difference the major efforts that have been made will have an effect. Next slide. It's important to base policy on facts, obviously, and to disregard myths in this area as in others. So the fact is, California homelessness is created in California. People don't come to California to become homeless or are homeless when they arrive. Very few people follow that trajectory. The primary cause of homelessness in California, as across the country, is the mismatch between incomes and the cost of housing. Generally speaking, I think in both the public and in Sacramento, the problem of homelessness is understood as a shortage of affordable housing. People generally hear the word housing in that phrase, but don't focus on the word affordable. The housing takes its position equal to the problem of extreme poverty. There are, in Los Angeles County before, there were 600,000 people in households that were spending 90% of their income on rent. So there are a tremendous number of people who are precariously housed and at risk of homelessness. Many people fall into homelessness and then get back out of homelessness and into housing with their own assistance. There are obviously other factors which determine which poor people become homeless, but neither mental health nor addiction disease are a primary cause of homelessness. Virtually everyone who has a mental health or addiction disease who is homeless is also extremely poor. It's the combination of those things, not the individual variations. The other thing that makes a big difference, and we see this when we come to the social dimensions of homelessness, is the degree to which people have family and community networks to support them when they do lose their housing, and are able to share housing with someone that they know. And pervading all of the things that I've mentioned already is racism of the kinds that I mentioned on the slide: institutional, structural, historical, and current racism. So let me say a few things about that before moving on. Next slide, please. Your odds of being homeless in California, if you are Black, are 6.3 times your odds of being homeless if you're white. There's no simple explanation. You have to look at history. You have to look at system failures across a range of systems. You have to look at ongoing discrimination in housing. We haven't eliminated housing discrimination or employment discrimination, and the criminal justice system, both for adults and juvenile justice, aggravates those things. There is no solution to homelessness in California that can ignore these racial disparities. Next slide, please. 85% of the people who are unhoused in California are individuals, that is adults or youth who are not accompanied by children. It's primarily, obviously, then an issue of the problems that I mentioned already in the context of individuals. So let me look at the possible income sources that low-income individuals have. Full-time minimum wage plays a little over $2,000 a month. SSI, SSP for people with disabilities unable to work pays less than $1,000. And the last layer of the so-called social safety net in California has basically been eviscerated since around 1995. And in Los Angeles County, for example, provides $221 a month for all of the needs of a person who's unable to obtain any assistance anywhere else. That income is available to spend in the context of rents that range from, well, they range widely, as you can see here. I've used the fair market rents established by HUD for a one-room apartment, bachelor apartment, no bedrooms, just a room and a bath. And the cost of that at the current market rates, what places are actually renting for now, in the Bay Area, as you can see, are about almost $2,400. In the mid-range costs, also close to the urban areas, but other urban areas, maybe $1,500 as a median for one room. And in the lower rent areas of the state, the Central Valley and rural areas, between $600 and $900. You can begin to do the math yourself on an individual budget level to see what the consequences are, particularly if someone loses their income for just a little bit, or has their expenses go up by just a little bit. Next slide, please. So let me give you some examples of how these things play out in concrete context. So Los Angeles County has, at last count, about 108,000 people who are trying to subsist on $221 a month. It would take 6 such people sharing one room at the fair market rate for a one-room apartment in Los Angeles to avoid being on the street. Obviously, that's not going to happen. And as a result, most of the people on general relief who succeeded in staying on general relief are homeless. To take another example, in Alameda County, the full-time minimum wage is $21.67. A family with one minimum wage earner would need to spend 90% of that family's gross income for a one-bedroom apartment in Alameda County. A disabled person in Sacramento County receiving the SSI payment would also need to spend 90% of their income on rent for a one-room apartment at the Sacramento market price of $1,060. And as I mentioned earlier, these numbers, when you look across the population, are quite staggering. Before COVID, as I say, 600,000 people were in households in LA County alone, spending 90% of their income on rent. So they were all on the precipice of becoming homeless. And many of them were falling into homelessness each month. As I say, most of them get back out of homelessness without any assistance, but some remain. And that residual is what accounts for our increasing numbers of homeless and unhoused people. Next slide, people. Next slide, please. Given these facts, one has to come to the conclusion that if you want to address what I think should be and is a statewide shame of our inability to house our poorest residents in California, the only way to do that is to have both an income and a rents or housing supply strategy. There is no housing strategy that will produce housing that's affordable to general assistance or general relief recipients, even in those counties that provide more than $221. And no income strategy can be effective if the incomes go up in a way that is outrun by the increase in rents. So we should, though, have specific strategies within each of those buckets. We've got to do a better job in the areas of unemployment and underemployment. And there's a lot of activity on that now. Obviously, all of this has been aggravated by the COVID downturn in the economy, but hopefully some of the money that's coming from Washington and has been generated at the state level will be spent on helping people do what is by far the preferred way of avoiding homelessness, is paying their rent to a private landlord, since almost all landlords in California are private. Not everyone can work. The amount of disability in California is similar to where it is everywhere else, but there are a lot of people for whom no employment is probably likely, or in any case, it will be underemployment and low paid. Housing strategies have to address both the supply and the regulation of the rents of those units that are already available. In order to do that, we've got to do something about the technologies of production. We're still producing housing in the same way we were a century ago, with the exception of air nailers. We're still building housing out of sticks and nails. The only thing that's really changed is that carpenters generally in construction use air nailers as opposed to 16-ounce hammers. The other constraint on production, obviously, is access to land. And by that, I mean both unoccupied land and land that is zoned at a level that's far below its capacity to house people. If we don't do something to increase the availability of land, and land in proximity to the jobs and or income, we're not going to make much progress. And then finally, this is going to take some time, so we've got to deal with both permanent housing and interim housing. The problem we have with respect to how we think about dealing with homelessness now is that permanent housing will take a long time, so we're working on that. And in the meantime, we should just work on interim housing. Problem with that is that unless people have a way to get out of interim housing just becomes really bad permanent housing. That's the experience that every state has had. Next slide, please. Interim housing can't be seen as just a way of forcing people off the streets. The police can move people, they cannot house people. And you don't need the police to move people into better alternatives if those alternatives are actually better. You need to know something about the details of the alternatives that are being offered and why a completely rational person might prefer a tent to what's being offered. And as I say, if there's no access to adequate permanent housing, then the interim housing just becomes terrible permanent housing. There are some things that we should be exploring in more depth. One is joining these two problems and employing formerly housed and at-risk people in the process of producing housing. That's not going to happen with the current technologies of production, but it can happen if we're manufacturing in plants modular and prefabricated housing. For example, some of the interim housing in Los Angeles now is in the form of essentially fiberglass structures that are quite small, and they are produced by people who were formerly homeless. And then finally, we have to revisit these constraints on income that we have, particularly the loophole that allows counties to set general relief at 221. And we should be looking at the experiments that are being conducted in Stockton and Oakland. And I hear my buzzer has gone off. And next slide, please. Thank you.
So thank you very much for that presentation. I learned quite a bit from that. So moving on to our next speaker, that is Randall Kuhn. He's a demographer and a sociologist who employs a wide array of research methods and data to study the social determinants of health, health program evaluation, and the health development nexus. He has conducted seminal research on the impacts of migration on health In Bangladesh, he leads a 35-year evaluation of the effects of randomized child and reproductive health interventions on health and social economic change across generations. His cross-national research and forecasts explore the effectiveness of global health policies and the role of improvements in health as a driver of social and political change. As the director of the Global Health Affairs Program at the University of Denver, he developed an innovative curriculum for applied decision-making and program design in global health. He placed graduates at leading global health agencies and built a programmatic emphasis on health and human rights of disabled, LGBTQ, Indigenous, and migrant populations as an essential component of achieving global health justice and equity for all. He founded the Goal 18 campaign for inclusive UN Sustainability Development Goals. So please, Professor Kuhn.
Thank you, Roger, and thanks to everybody for coming out. I am operating my own slides. And forgive me, there's kids banging out in the hallway, but I think everything's good. So what I wanted to talk about today, and here I'm going to set my timer as well. What I wanted to talk about today was a little bit, I just want to push a somewhat provocative notion of homelessness as a medical condition. And that's not to say that I necessarily believe that homelessness is a medical condition. And it's certainly not that I think homeless and unhoused people should in any way be defined by the medical problems that they face. But it's merely to push the idea that homelessness is a cause of many, many health problems that have been laid bare during the pandemic, both direct and indirect consequences of the pandemic. And that if we think of homelessness as a medical condition, it frees us up to a whole world of financial options for addressing some of the immediate consequences of homelessness, thereby potentially freeing up resources to focus on all of the many things that Professor Blasey brought up that are also needed in the long term. When I think about this issue, I go back to my kind of leading personal expert on homelessness, which is Dr. Coley King, director of homeless medicine at Venice Family Clinic, and therefore our UCLA colleague. And he practices street medicine, not the kind of street medicine that we think of as let's come up with a program for street medicine, a package of services that can be delivered on the streets as sort of a next best thing. But what Coley does is just practice medicine on the streets in every possible way he knows how, and mobilizing every possible resource imaginable. And, and the simple message that, he delivers both to clients and patients and to colleagues is that diabetes cuts 8 years off the average life expectancy, right? And diabetes is not one thing, it's a syndrome. Homelessness cuts 20 to 30 years off life expectancy. And clearly homelessness is not as simple a thing to define as diabetes, or at least the health effects. But let me go through how simple it is to visualize what path is taking us from homelessness to that 20 or 30-year loss of life expectancy. And then I'll circle back to some of the potential implications of that, which, in a way, many of you can think through the implications far better than I can. Okay, homelessness is a risk factor for disease occurrence, treatment and recovery, and fatality. Just to put a few numbers on this, and the numbers don't really nearly tell the story, but compared to housed population, or compared to the general population, homeless people are about 3 times as likely. So this is the relative risk, just how many times more likely are you to have a particular condition. 3 times more likely to have hepatitis B. And as we all know, that's an incredibly costly condition and incredibly debilitating. 10 times more likely to have HIV infection, 16 times more likely to have hepatitis C, which is even more costly, but potentially treatable, again, at high cost. And I put numbers on this. The relative risk of active tuberculosis is almost it's almost silly to put a relative risk on this, because the point is it hardly exists in the general population, but it's 100 to 1,000 times more likely among the homeless population. Those things people may be aware of, in addition to some notable infectious disease outbreaks on the streets of LA and other places. Chronic disease is a little harder to understand, right? But it's easy to figure out if you think about it, right? That chronic disease risk factors for chronic disease are quite prevalent in homeless communities, but more importantly, treatment is just not available. So Dr. King always says that the biggest issue that they face is addressing movement disorders like Parkinson's, MS, conditions that whatever treatment, right, there is a treatment for opioid overdose that doesn't need to be refrigerated. The treatment for Parkinson's and Huntington's disease require multiple medications that require adherence to schedules, but also more importantly, just require refrigeration, which is hard to pull off when you're unsheltered. Adding to this is the rapid aging of the homeless population. And that is not to say that the homeless population as of now is younger than the general population in terms of chronological age. But the number over 65, this is our forecast work on LA, New York, and Boston, that the number of over 65 homeless in Los Angeles has already tripled in the last 10 years and is set to double again in the coming 10 years. And that's before you consider that normally how we would think of age among a homeless population is that the risk factors they face would be those more associated with someone 10 to 15 to 20 years older than they are, than their own chronological age. So here's the similar numbers for COVID-19. And I think this is less well documented. In fact, in Los Angeles, there have been a number of stories published on how homeless people dodged a bullet, or that somehow the COVID-19 pandemic was not that bad among homeless people. And what that really means is that unlike many other diseases, which are 3 to 10 to 1,000 times more likely and more fatal among homeless people than in the general population, COVID-19 was only a little bit worse. And that is, infection rates were not that different, and the homeless population is a little bit younger. And so the overall numbers don't look that bad. But then if you look below the numbers, if you look again at the relative risk of like for like, a 30 to 49-year-old homeless person versus a housed person, 4 times more likely to die. 50 to 64, more than twice as likely to die. Over 65, more than twice as likely to die, right? So even our one case of a disease where, and again, we know part of why COVID-19 didn't have a much higher infection rates among homeless people and didn't lead to even worse fatality and complication outcomes is because of things like Project Roomkey and de-densifying homeless shelters and all the amazing outreach efforts of organizations across the state in public health and homeless services to reduce risk factors for COVID-19 and protect those most vulnerable to COVID-19. But even at that, risks were of dying among the population were still 2 to 4 times higher. That's sort of our best case scenario for homeless health. And of course, we say that as a best case scenario when we talk about COVID-19 deaths. But then if we look at overall deaths among the homeless population during the COVID-19 pandemic, what we see is that in counties across the state, so here's Alameda, Santa Clara, and San Francisco, that the number of homeless people dying on the streets has gone up precipitously during the pandemic. And this is not some coincidence, right? So here are the data, monthly data from Los Angeles County. And what we see here, so this is 2018, 19, and 20, right? January was same or lower as previous years. February, same or lower as previous years. March, 30% higher. April, May, June, July, increasing, right? That something happened. And again, we try to be very careful with our scientific inference where we work, but you don't need a very complex study design to say that something happened in March of 2020 that increased the number of deaths among people on the streets of LA and all across California. Now, what that is, we don't think it's COVID-19 fatalities, though we can't rule it out. We know LA County released a report attributing half of those excess deaths to substance use, but the other half were unexplained, which is troubling. And a theme that I normally return to a lot here is that there's just a lot we don't know because data are quite thin. We're dealing with a real patchwork of some administrative data, some data from the point in time count, which of course we don't have this year. And so when I get to now, I can tell you about the levels, but when I talk about what are the mechanisms, what is it that leads for me to say homelessness is a medical problem, and then say, what is it about homelessness that leads to excess health risk in very specific ways? It's a little bit hard to say exactly, right? We know that the lifetime exposure to poverty and underhousing and structural racism, the conditions that Professor Blasey was pointing to, are affecting health overall among homeless people. But we can also say that the gap, right, that the deterioration of the health of homeless populations increases with the longer duration, the longer time they're homeless. And so we come back to exposures to risks during homelessness, environmental risks, substance risks, risks of violence, a whole, and again, lack of access to care and preventative medicine. But a big piece of this is chronicity, right? That in California, a larger proportion of homeless people have been homeless for longer periods of time, and these effects accumulate. One of the things that we're working on right now is research using homeless management information systems data from LA County to try and just quantify some of the effects of, say, an additional month homeless on measures of health, even though we don't have very detailed measures of health, and even though duration doesn't tell us exactly what specifically is happening, it at least us get somewhere. And these are questions that you think we would have answered right by now, but we haven't. And of course, unshelteredness adds a wide array of additional risk factors. And part of what we're trying to quantify is how much is the excess burden, say, associated with a month on the streets versus a month in a shelter. So we're attempting to quantify these risks. One effort that we're making to quantify these risks is to try to build towards having a mobile a platform on which we can issue monthly. So, right, a large body of surveys that reflect the attitudes, the health experiences, but also the voice of unhoused populations on a monthly or even more frequent basis. So we can basically take the temperature of how people are doing, what risks are emerging. And again, this is something that would be very useful in housed populations that are at high risk of homelessness. So this is just an example. We're in a pilot stage right now doing a survey with Venice Family Clinic. This was supported by the UC Office of the President's COVID-19 Research Initiative. And what we're basically showing here is, right now we're focused on the vaccine issue. So what we're observing is a relatively high rate of vaccine hesitancy among the homeless population compared to the general population. And what we see beneath this basic finding is a story that the drivers of vaccine hesitancy among the homeless population are quite similar to those among the general population, which is that people who have greater health risks may have more to gain in our minds from taking the vaccine, but they may also see higher risks from the vaccine. And that risk can be amplified by particular social interactions and networks, especially the use of social media. So implications of the medical approach quickly, and again, in some ways, this is where my imagination leaves off, but I'll just say that Project Roomkey in itself is somewhat an expression of this approach, right? Is that resources, both federal, state, and local, were allocated to housing to protect people from a health risk. So it is exactly what sort of we would think we would want, is say a doctor can prescribe you housing, and that this would be a relatively easy process. Because there was a lot of uncertainty in the midst of a pandemic about what FEMA was paying for and so on, it was not always easy to simply turn around and say, okay, you need housing for your health, we're going to give it to you. But the idea is there. This gives us a platform for moving forward. obviously vaccine prioritization for homeless populations in Tier 1B, which was a bit of a struggle in different jurisdictions and is still a struggle in some, was another expression of this. I know there are efforts afoot to expand access to street medicine, and in terms of payment for different services, in terms of access to different kinds of providers, there are a lot of advantages to thinking about homelessness as the medical condition that is being treated in terms of streamlining billing. And of course, that's before you get to the big elephant in the room would be, can healthcare dollars, especially healthcare dollars devoted to people over 65, be used to actually finance housing solutions? And that is housing solutions across the range of options that Professor Blasey mentioned. So in some cases, these are relatively low cost, people just need subsidies to get back on their feet. In some cases, it's quite intensive housing. But again, the more intensive the housing need or the rehabilitation need is, the more potential cost savings there are in the health sector of providing housing. So a couple other ways in which this is showing up. So we're doing a big project right now looking at the effectiveness of single site and scattered site permanent supportive housing on a wide range of outcomes. And this is funded by PCORI, the Federal Patient-Centered Outcomes Research Institute, right? So they're very interested in homelessness in housing, in permanent housing, as a key driver of healthcare outcome, of patient outcomes, patient satisfaction, and of course, costs, and even thinking about different housing models. There's also, we've put together a pilot for housing all seniors in LA, homeless seniors in LA County, which has these fairly big holes that would need to be filled with potentially with healthcare financing. And so I'll leave it there. Thanks to everyone. I'll just say next week, we're gonna launch our Homeless Research Data Collaborative, which will use these monthly data platforms that we're developing to share and disseminate results across, and we hope to keep building this up in coming months. Thanks so much.
Thank you very, very much. And let's see, Gary, do you want to turn on your video too? Because we're going to go right into the Q&A. And remember, please submit your questions. We anxiously look forward to your questions. Actually, they look forward to your questions, but I'll start the ball rolling. It was sort of mentioned in the first presentation about other states, and so that's my question. Can you point, either one of you, on either one of your topics, point to models, successful models, anywhere else in another state, another country where you said, wow, that's really working, and why aren't we doing this here? So that's my question.
Sure, it's hard to find states where, or other countries. Finland's the only country in the world that's eliminated homelessness as an actual fact. But within other states, there are specific examples of things that are being done. For example, I mentioned in Seattle, the pallet shelter company has hired people to build the interim housing units that are being erected in Los Angeles. And this is not a housing, but an interim solution. So it's a piece of a solution. And a lot of places have decided to remove the police from being the frontline contacts with unhoused people and replacing them with folks who actually have some skill and knowledge about how to connect people to services. But I don't think that anybody is facing the kind of crisis that California is facing. So what people have been able to do on a smaller scale may not scale up for us.
I'll say, right, we have, I think the fact that we can only point to Finland as a true success story is problematic. But let me just say that it depends on how you define success, right? So New York, I would point to as a model for, right? New York was able to very successfully for a pretty long time, reduce levels of unsheltered homelessness to close to zero through a very concerted action, right? Kind of an all hands on deck approach, which was obviously offer people shelter, but not expect them to take it right away. That is, provide street medicine to engage clients, use peer networks, be present in hospitals, right? That people who are suspicious of shelters may not want to be in a shelter most of the time, but the day they're coming out of a hospital may be the day that they do want shelter. So if you're ready for, if you let people know, and again, part of that was right to shelter, right? If you say that shelter is your entitlement and we're here for you and we're engaged with you, then you can bring people into shelter. Now, the problem is in New York that nothing else had changed in the economic situation and in the housing market. And so they've ended up in kind of a permanent shelter state, which is both quite costly and I think very demoralizing for recovery. And so we want to find a way to do what New York did, but also finish the job.
Great, thank you both. So let me, the next question I have is thinking about COVID, because that's what we're dealing with right now. And we hope to see the end of the light at the end of the tunnel. The variant issue aside, people are getting vaccinated. And so what do you think is going to happen when everyone is vaccinated as we approach herd immunity, specifically on the homeless problem? I mean, there's only two ways. I mean, it could stay steady, but it could also be better. We could see a lot of improvement, or it could get continually worse. What do you think are the factors that are going to determine the trajectory after we make it through this virus?
Well, I'll let Professor Kuhn talk about the health aspects of that. But of course, the other effects are the economic collapse that has befallen the state, and the degree to which people, especially at the low end of the wage ladder, have lost their incomes. We've got to have to, as I mentioned in the presentation, focus on getting those people back with the incomes with which they can pay rent. And I think that depends in part on getting the economy rolling again, but it may require some special assistance to those parts of the economy that employ low wage people.
You know, it's a tough one. I think what I would say is nothing will ever be the same. And what I mean by that is that the pandemic has laid bare how fragile even the incredibly harsh reality, right? What little unhoused people had prior to the pandemic, it was sort of laid bare how easily that can be disrupted by the pandemic, as evidenced by the spike in overall mortality. To the positive, what's also been changed irrevocably is the system. And that is, there's been a lot of shuffling quantitatively, right? There have been a lot of people who were moved into room key and then moved out of room key and moved into interim. There was a reallocation of resources. There was de-densification of shelters, but there was also adding beds to shelters, right? There was a lot that happened that has changed. An enormous number of people have moved in the last year, even if they only moved a few feet, and that's especially true in LA, where we've also had this legal case going on. But a lot of people have had their situation disrupted, in some cases to the good, but in most cases not to the good. But the positive is that the system has been disrupted, right? That Project Roomkey proves that there is another way to go, right? Which is we can mass mobilize a large amount of resources, financial resources, and physical places for people to stay. And as Professor Blasey says, if you sort of take that to its logical extent of increasing our capacity to produce housing, being more creative with existing units and so on, that everyone is watching us. They know that it is possible to rehouse assess, and rehouse a large number of people on the fly. So why aren't we doing it?
Great, thank you. So we have a thought-provoking question that was submitted. Here it is. Should people have the right to be homeless? Or should there be mandatory shelter policies? Which one of you want to tackle that one?
Well, we already have a right to be homeless, meaning that as a de facto matter, the only thing that happens when you become homeless that doesn't help you is the justice system gets involved. That doesn't improve anyone's circumstances. And one thing we also know is that it's really the wrong question to ask. The question is, what options can we provide to people who don't want to be homeless, which is the vast majority, 95+% of people who are offered an alternative that's better than what they have will take that alternative. So it's a question that goes to a problem that really does not exist if you look at the full range of circumstances surrounding it. And it's a distraction from that problem. If you want to reduce the numbers of people that you see on the street, the problem you have to solve is not that the people on the street don't want something better, it's that they don't have something better.
Yeah, and I'll just add, I mean, I think this past year we've all been edging around a lot of questions about rights that we haven't, I feel like we haven't had the mind space to tackle given everything else we've been through. But, you know, the sports bar around the corner from me has been one of the county's most active flouters of stay-at-home orders and mask orders. And, you know, do they and their customers have the right to stay open is sort of, I would put this question for the people who, I believe that most people who are unsheltered don't want to be on the street, the vast majority, you know, well into the 90s, 90%, 99% range. For those who truly wish to be on the street, if they're not harming anybody, if they're harming people less than the sports bar on my corner, then I think that's where we can start to have a conversation. Until then, you know, we all need to think more carefully about our rights and how our expression of our rights impinge on those of our neighbors.
Great, thank you. So let me ask you a question in terms of, and both of you can correct me if I'm wrong, but you know, there's this philosophy that most people, I'll be generous, most people say, yes, we have to do something about homelessness. But when the issue comes up, well, then how about in your backyard or in your neighborhood, we build X, Y, or Z, and then suddenly the attitude changes. Well, I want you to solve the problem, but not in my neighborhood. And so if we start looking at these fringe areas way outside the city, et cetera, I don't know if that's the solution. So let me know if I'm thinking about this correctly, and please offer your opinions.
Well, I think some of the success stories we have had have come from communities that have recognized the fact that the homeless people that they see are their former neighbors. And as a matter of actual fact, homeless people are not very mobile. Most of them are within a few miles and a very few miles of where they last had housing. So if you talk to communities about just housing the homeless people that they have, then and they begin to identify them as not these alien creatures that are mostly lurking in Skid Row, and they're going to run up to Whittier because they've heard it's a nice place. Once you get rid of that notion, which is false, then I think it begins to change people's attitudes. And the other thing is you have to have interventions that are not really disruptive of the neighborhood. There are some ways of doing sheltering that are really bad for neighbors, but they're also really bad for the people who live in them. Big tents and with lots of people congregate is certainly a terrible idea during the COVID times, but it's a terrible idea generally. We can do better than that. We can do lower impact. And in the case of, for example, Project Rimke that Randall's talking about, there's no disruption. There were people in there in those buildings before. There are people who are in them again. So, and we're going to have a lot of vacant housing and vacant office space, not so much housing, but office space and tourist hotel space that that people won't even notice. So people don't know what housing is around them typically, if it looks like housing and operates like housing.
Great.
I'll just add that NIMBY is I struggle with the term NIMBY. Because not in my backyard, right? Sometimes there is a housing, often there is the people that I talk to who are most animated against some particular project are people who literally face a project that, as Professor Blasey said, is not to the scale of the neighborhood. And that project is literally in their backyard. And that's one thing. But a lot, quantitatively, a bigger share of the resistance to particular units of housing, and this was laid bare in Roomkey, is not in my backyard. It's not in my census tract or not in my zip code. And that frankly has to stop, and that can be overridden. And it's notable that during the clearance of the encampments in Echo Park in LA over the recent weeks, the resistance to the encampment in the neighborhood was much lower, right, among residents of the neighborhood, because as Professor Blasey says, they recognize that that could be them, that these people are from their neighborhood. But with Project Roomkey, it was the resistance was, right, there's no freeway, right? These motels were outside of Hollywood and downtown, where, I mean, in downtown, very few hotels signed up to Roomkey. Most of the hotels were freeway motels, and the resistance was coming not from your backyard, it was coming from, I don't want these people anywhere in my town. And that resistance can be conquered, but you really have to separate out. You can't link the resistance to a project in your backyard to that.
Great. Thank you so much. So another question, which I'm sure many people think about, and this is really on the topic of interim housing, not long-term housing. I mean, you hear so many different approaches: hotel vouchers, mobile housing, emergency shelters. Is it all of the above, or is one preferred, you think, by either one of you?
Well, it's a little bit like, would you like food or would you like water? You will die quicker if you don't get water, but ultimately you need both. And we obviously cannot provide permanent housing overnight to 161,000 people, which was what we had in January of 2020 in California. Can't do that overnight. But we have to have something for folks who can get back into the standard housing that's available, and something that's at least better than the other options that people have, and is a close approximation to housing as we can get, and that's much less expensive. And but we have to have a system that has both interim housing and permanent housing, or as has happened in New York, as Randall mentioned, people spend years in interim housing. So the better that interim housing is, the less objectionable spending time in it is. But at the end of the day, we're going to have to deal with the imbalance between the vast oversupply of extremely poor people and the shortage of lower cost, smaller units.
And not just interim housing, right? Shelter, and shelter doesn't have to carry such a stigma that it does among many homeless people, right? There are new models of shelter as something that looks more like interim housing, and as of shelter or safe haven as something that is not as restrictive, that carries some of the benefits of permanent supportive housing models. But right, the reality, I mean, quantitatively, if you look at the numbers, right, I mean, it's all hands on deck, both in terms of types of housing, of numbers of units, and unfortunately, that means cost.
Okay, this has been a wonderful question and answer period. Let me end with one other one. I want to be myopic and think about universities because we're from universities. I guess I was not as clued in to student homelessness as much as I am now. Hearing stories of students living in their cars occasionally in one of the UCLA parking lots. Any comments at all, brief comments either one of you have on the homelessness problem in the student population?
So maybe I'll start on this one. This is one that we've been working a lot on. So the UCLA Healthy Campus Initiative has been incredibly supportive and generous in helping us do research on this. So I'll send you, I have a PhD student who's about to finish her qualitative research on experiences of homeless students. But it's troubling, and the numbers, and it's hard to get a handle on quantitatively, because it's not like that many students are on the streets all the time, but the number who are in their vehicles some of the time, or the number who are in an unsafe housing situation because the alternative would be to be unhoused is quite troubling. And one of the things we've observed is that during the pandemic, this has really changed quite a bit, right? So a lot of student homelessness was related in one way or another to supercommuting. So students were having to choose between driving all the way from San Diego and driving back home at night, or sleeping in their car, or staying with a sketchy boyfriend. And out of those three options, the car might have been the best of the three. And now it's not, right? Now it might be the sketchy boyfriend, or it might be, and telecommuting, right? Taking online classes have meant that it's also just staying at home. But it's sort of patched over that particular problem and revealed new problems for some students. But, again, it's clearly, a lot of it's related to, the vast majority of it is financial, but it's just, you die reading these stories of just students trying to scramble out and just sinking further and further, and nothing, just like with a jobs program, anything you do to help us, you can provide pipelines, scholarships, whatever, but if a student is sinking, they're sinking.
Yeah. Gary, a quick comment before we close this session?
It's a good question, and it raises the fact that there's a vast amount of homelessness that's not visible, that's not in encampments. Most of the unhoused people who lacked shelter that were counted in Los Angeles were in vehicles. And vehicles have long been sort of the first stop on the way to the streets. So anything we can do to help people, both give them a safe place for the vehicle, but get them out of that vehicle as soon as possible, is something that we should be doing, whether they're students or working people.
Great. Thank you both. This was really a wonderful discussion. So I want to thank also all our participants out there. We can't see your faces, but we know you were there. Just want to emphasize again that UCLA is committed to promoting research that addresses homelessness. And please reach out to the government relations people if you have any questions, including the video presentation, because this has been recorded. So thank you so much again, and enjoy your weekend.
Everyone.